Good evening, everyone. Welcome to our second day of the Cleveland Clinic and Ohio Clinicians for Climate Action's Climate and Health Activate, Educate, Implement Symposium. All live events are going to be recorded and can be found on our OCCA YouTube channel beginning next week. So if you miss any part of the live Q&A, you can find it there beginning next week. Links to that will be sent out. Just as an FYI, this symposium is a learn at your own pace symposium. All the pre-recorded sessions are available on Whova and can be watched at your convenience. During these live events, we will watch the pre-recorded session and be joined by the speakers for the question and answer after we view the videos. This evening, we will be watching Dr. Alan Lockwood speak on climate change and air pollution. We will also see Lucinda speak about how nurses can get involved in climate change mitigation in her presentation titled Climate Change, Nurses Respond. Please remain muted during the duration of the session. If you have questions, please write them in the chat box. At the end of the presentation, I will populate a link for a survey for this evening's live session. We invite you all to complete the survey as it provides the symposium hosts and speakers with valuable feedback. Nurses, if you would like CNEs for this session, you must complete the survey. Once submitted, a link to the CNE certificate will be shown. Physicians, directions on how to obtain CMEs for this session are in the syllabus located in the Documents section on Whova. An updated syllabus is available now. So without further ado, I am going to share my screen and we'll begin the first video.
Well, thank you for joining this symposium on climate change, and this talk will be about climate change and air pollution. My name is Alan Lockwood. I'm a past president, a member of the board of directors of Physicians for Social Responsibility, an emeritus professor of neurology at the University at Buffalo, and a member of Ohio Clinicians for Climate Action. I have no conflicts of interest to reveal, and all royalties from any books that I have published go to Physicians for Social Responsibility. I'm going to be talking to you about the links between air pollution, climate change, and health, with an emphasis on particulate matter, particularly the very small particles, the so-called PM 2.5, and ozone, and I'll put some emphasis on wildfires since they have been attracting a lot of attention in the media. I'll talk a bit about formation and sources, effects on health, and actions to mitigate and adapt to this problem. Well, unless you've been asleep, you know that temperatures are increasing, and these are the data for Cleveland, Ohio since 1854 and 2012, and it shows an inexorable increase in temperatures. So here in northeastern Ohio, like the rest of the world, climate change is actually taking place. The debut of concerns about air pollution dates back perhaps to, in the United States, perhaps to 1948, when in October, there was an inversion over the town of Donora, Pennsylvania, where there was a steel mill that coated steel products with zinc. And this inversion layer trapped the smoke and pollutants from the mill over the town, killing quite a number of individuals, hospitalizing a huge number of others. And to this day, the remnants of that disaster are still evident in Donora. There's a small smog museum there, which if you're in Donora, is definitely worth going to. And the Donora people like to think that this is the beginning of the emphasis on climate, on air pollution and health. And this is a photograph of one of the infamous fires of the Cuyahoga River. This one occurred on June 25th, 1952. Now, in 1970, during the presidency of Richard Nixon, he proposed that we should start the Environmental Protection Agency. And it started operation on December 2nd of that year with a mission to protect human health and the environment with an adequate margin of safety to protect health. That same year, the Clean Air Act was amended and it established national ambient air quality standards. These are standards that are set to guide health behaviors and gave the authority to the agency to enact regulations that enable the enforcement and the production of these air quality standards. And I'm going to be focusing on two of these criteria pollutants: particulate matter, particularly that with an aerodynamic diameter of 2.5 microns or less, and ozone. And these two pollutants are responsible for 90% of all of the deaths that are due to air pollution. So hence, it's reasonable to concentrate on them. Now, in 1990, there was another amendment to the Clean Air Act called variously as the Acid Rain Program. And this empowered the EPA to set limits on the emissions of oxides of sulfur and nitrogen, which were coming predominantly from coal-fired power plants and causing acidification of many of the lakes in the northeastern part of the United States. Now, these compounds are both very chemically reactive, and they react with other elements that are in the atmosphere to produce the so-called secondary particulate matter, in addition to the primary particulate matter, which is formed by combustion, usually of fossil fuels, such as coal, oil, and natural gas. Now, The Lancet, which is a very well-known medical publication, has this group that publishes what they refer to as the Countdown on Health and the Environment. And in 2018, they said that trends in climate change impacts, exposures, and vulnerabilities show an unacceptably high level of risk for the current and future health of populations across the world. Prior to that, they said that climate change presented an opportunity, but now they're saying that it's an unacceptably high level of risk. Now, this somewhat complicated slide shows that the Clean Air Act, particularly the acid rain amendments, are having the desired effect on health. This, on the vertical axis, are annual early deaths, and in this group, due to road pollution, and in the dark blue color, early deaths due to ozone, and the lighter color due to particulate matter. So in this interval between 2005 and 2018, around 10,000 or more premature deaths were being prevented by the acid rain pollution program and the control of emissions from road vehicles, which further emphasizes the importance of the so-called CAFE standards, the corporate annual fuel economy standards. Electric power generation, which had already led to huge decreases in the production of particulates and ozone, continued to have its effect with further emissions on premature mortality. Unfortunately, the commercial and residential sector showed some increases. This is a very complicated sector that contributes to the pollutants. The Excel spreadsheet that goes along with this has over 120 lines, so it's very, very complicated. But the bottom line is that the Clean Air Act was having tangible, positive effects on the health of Americans by reducing mortality and morbidity to the tune of the last estimate published by the EPA of an estimated reduction in total cost to the US economy of somewhere around $2 trillion per year. So this is arguably one of the most important public health measures that's ever been presented. Now, this is an even more complicated slide that's extracted from my book, The Silent Epidemic, which is about coal, and shows how particulate matter affects huge number of organs. So it's inhaled into the bronchioles and the alveoli. It triggers reflex arcs in the autonomic nervous system that affect blood pressure and heart rhythm, leads to the production of systemic oxidative stress and inflammation. And some of these particulate matter bits get into the bloodstream and circulate around to other organs, so that the grand total effects are protean on various organs throughout the body. It accelerates atherogenesis in blood vessels that go to the heart and to the brain, which cause heart attacks and strokes. It increases clotting, which contributes to those two diseases. Not shown on the slide is the fact that some of these particles go directly into the nervous system through the olfactory bulb and enter the brain, where they can be seen on electron microscopy. And once in the brain, these particles trigger the same kinds of oxidative stress and inflammation, contributing to the overall contribution to the premature deaths from the leading causes of death in the United States of cancer, heart disease, respiratory diseases, stroke, and now increasingly evidence to support type 2 diabetes and degenerative neurological conditions such as Alzheimer's disease. Now, periodically, the EPA is required to reevaluate the National Ambient Air Quality Standards. And this is their assessment of the effects of particulate matter on various domains of health. And the EPA's own estimates say that it's causal for cardiovascular effects, likely to be cause of cancer, likely to be the cause of respiratory diseases and nervous system diseases, and causes all-cause deaths to increase. Now, in spite of the overwhelming evidence that this is an important cause of disease in the United States, the agency decided in its wisdom that further reductions in the exposure to particulate matter were not warranted, even though none of the published studies in the peer-reviewed literature shows that there is any concentration below which it's safe to be exposed to these particles. Now, one of the things that's happened over the years is that both the assay methods and epidemiological methods have gotten better, so that instead of dealing with long-term exposure over years or months, it's possible to link very short peaks in the exposure to these pollutants, such as particulate matter, to various diseases. And this slide shows a publication from 2012 that shows that a peak in the concentration of small particles that occurs somewhere between 12 and 14 hours before a stroke is linked to the subsequent occurrence of the stroke. And similar data have been shown for myocardial rhythm disturbances, so that in our comments that we submitted to EPA about the particulate matter standard, we urged a further reduction and a revision in the time course over which these effects were looked at. I'm going to talk quite a bit about fires, since that has been in the center of attention. Since 2000, there have been over 73,000 wildfires per year in the United States. And although there has not been very much in terms of the number of fires in the past 30 years, the acreage that's consumed by these fires has nearly doubled since the early 1990s. And it remains true that somewhere around 85 to 90% of these fires are caused by human activities of various kinds. But these fires are exacerbated by climate change. The hotter weather and drought have dried out the forests. They've brought the temperature of the burnable materials closer to the point where they catch on fire. And underlying all of this are invasions of pathogens and insects such as the pine bark beetle, which have killed large numbers of trees in the West, making it a setup for more fires. Now, just this recording is being made the day after Labor Day weekend, and over Labor Day, temperatures topped 120 degrees in some parts of California. And that's a temperature around which it's impossible for humans to survive out of doors. The mechanisms for controlling temperature, such as sweating, fail to keep you cool. And the California fire authorities published these data that said between the beginning of the year and the end of August, there were almost 6,000 wildfires with over 1 million acres burned. And on the radio this morning, I heard that number is up to closer to 2 million acres, which represents about a 50% increase in the number of fires over the average of the past year, and 3 times the number of acres that have been consumed. Now, these fires produce enormous plumes of smoke, as seen from the International Space Station. You can see fires in Southern California, and they have blanketed cities like San Francisco, as shown by these 2 photographs taken 1 week apart towards downtown San Francisco from Alcatraz Island. And you can barely see the outline of the city in the lower portion of this photograph that shows almost complete obscuration. Now, these small particles that are produced and part of the smoke exact a further health toll. Heavy smoke increased the number of asthma emissions as small particle concentrations rose far above the National Ambient Air Quality Standard. They led to increases in hospitalization for asthma, particularly among the elderly, and sadly right me at the present time. Children aged 0 to 4 years increased by 8.3%, and there was an overall increase between the ages of 20 to 64. There were also increases in hospitalizations for acute bronchitis and chronic obstructive pulmonary disease. Now, these plumes of smoke, which can be seen from the space station, are shown in satellite data extending all the way across the United States, so that the effects of wildfires extend far beyond the people who are trapped and at the present time awaiting evacuation by helicopter from portions in the Creek Fire all across the United States. So with the particulate, there's also ozone that's not shown in that particular photograph. I'll return to ozone again in just a moment. So the estimates for annual mortality due to wildfires are somewhere around 340,000 deaths per year worldwide. So it's a major health problem. I'm going to shift gears and talk a bit about ozone. This is what you learned in high school chemistry, perhaps. Ultraviolet rays from the sun split oxygen molecules that recombine to form molecules of ozone. But the real picture is much, much more complicated. And it involves carbon monoxide, some of which comes from wildfires, volatile organic compounds that are released. Ironically, some of them come from trees. So it's a very, very complicated picture of ozone formation, which is likely to increase in the future as temperatures increase and climate change goes on unabated. Now, in 2020, the integrated science assessment for ozone showed that it was causal for respiratory disease in the short term and likely to be a causal factor for respiratory disease in the long term. It was likely to cause metabolic effects by inhaling a release of stress hormones affecting metabolic systems leading to diabetes, and suggestive for a number of severe adverse health effects. Now, carbon monoxide that's produced by forest fires and a part of that plume that I showed you before are a precursor to the formation of ozone, and this increases after wildfires. So after the wildfires in the summer of 1995, there was between a 10 and 30 part per billion increase in the ozone concentration in the southwestern portions of the United States, also in the southeast. Canadian fires led to increases in ozone concentration in parts of Ireland. And in July and August of 2004, Canadian and Alaskan wildfires led to increases in particulate matter and ozone concentration, particulate matter and carbon monoxide over continental United States and even in Europe. So look at a medical perspective on climate change. In public health, we talk about primary prevention of diseases. So primary prevention for climate change is achieved by reducing greenhouse gas emissions. So it's important to support the EPA and organizations like PSR, Ohio Clinicians for Climate Action, to decarbonize electricity and other elements of society. And your expertise as healthcare professionals and concerned citizens make you highly qualified to discuss this issue. It's important to vote for people who will reduce greenhouse gas emissions. Secondary prevention concerns adaptation to a problem that exists already. And those are things that you can do to reduce your personal carbon footprint, support federal, state, and local efforts to adapt to climate change, lobby your senators and congressmen, and everyone can do something, from doing Meatless Mondays to giving dollars to support organizations that are working to make this a healthier and safer world in which to live. So for further reading, I would suggest the following. You can get weekly updates from the New York Times through Climate Forward, and these publications that will be available when this talk is made available on the internet. So thank you for tuning in, and thank you for your attention.
All right, now we will move on to Lucinda Cape's presentation.
Climate change, nurses respond. As the largest group of health professionals in the United States and more than 20 million worldwide, nurses do have a role in addressing the health effects of climate change. Here are the required disclosures. The outcome. You will increase your knowledge of health impacts of climate change and will be more likely to engage in climate change solutions. Why nurses? Well, nearly every year, the annual Gallup Poll's Most Trusted Professionals survey ranks nurses at the very top. It would seem nurses would be an ideal group to speak to and educate the public on climate change and health. People would trust what we had to say. We can help gain even more support for reversing climate change. The Climate, Health, and Nursing Tool, or CHANT, is a 10-minute online survey asking respondents about awareness, motivation, and behaviors related to climate change and health. The items were developed in 2017, and results from the first year now, 2019, are in analysis. Starting with the 2020 version, the survey will be open to all health professionals. The preliminary 2019 results showed that the majority of nurses want to change practice, want to reduce greenhouse gas emissions, and they are motivated to act by the health impacts, the future, clean air and water, family, and to protect the planet. The Nurses Climate Challenge is the first attempt at launching a national movement that revolves around nurses educating their healthcare colleagues on the health impacts of climate change. The goal is to educate 50,000 The challenge involves recruiting nurse climate champions who get access to a set of online resources created by Healthcare Without Harm and the Alliance of Nurses for Healthy Environment, or ANNE. Healthcare Without Harm is an international nonprofit, and Alliance of Nurses for Healthy Environments is a national nonprofit nursing organization with the mission of promoting healthy people and healthy environments. Nurses who are interested in becoming involved can find more information and can register at nursesclimatechallenge.org or from the ANNE website, which is referenced on that on the third to the last slide. So I think the nurses' response to climate change can be stated with 6 P's: our past, our patience, our practice, our personal habits, our partnerships, and our politics. In her famous book, Notes on Nursing, Florence Nightingale in 1860 wrote, "Nature alone cures. Medicine, so far as we know, assists nature. And what nursing has to do is put the patient in the best condition for nature to act upon him." She was referring to fresh air, clean water, and safe, nutritious food, all qualities threatened by climate change. And by fighting climate change, nurses can help put nature in the best condition to help people. In the American Nurses Association Scope and Standards of Practice, Standard 17 reads, "The registered nurse practices in an environmentally safe and healthy manner." Among the competencies are reducing environmental health risks to self, colleagues, and healthcare consumers, communicating information about environmental health risks, and exposing reduction strategies. In 2008, the American Nurses Association House of Delegates authored a resolution on global climate change, including the provisions that it is critical nurses speak out in a united voice and advocate for change on both individual and policy levels. And further resolve that the American Nurses Association supports initiatives to decrease the contribution to global warming by the healthcare industry. Our patients. Nurses are beginning to understand the climate-related issues that affect the patients that they care for, such as those presented throughout this webinar series. When nurses explain what then prepare. For example, when discharging a patient at greater risk from effects of increased heat, it's not enough to simply say, "Stay cool." Nurses need to communicate the real threats from increased heat waves. Do patients have access to air conditioning? What if the power goes out? Do they have someone to call or come over or check on them? Do they need information about the community cooling centers? Do they have transportation? And it's not just for typical patients at risk, the very old, the very young, and those with chronic conditions. Nurses have conversations with young, healthy people who happen to work or play outdoors during hot months. They discuss access to shade, rest, and water, the 3 things that bring relief from outdoor exertion during the heat of the day. Similarly, nurses can relate climate change effects when talking to friends and family about their health. Well, you're experiencing worse allergy symptoms because climate change makes the seasons longer and stronger. Or, oh boy, our air quality is worse today. Must be from those wildfires. Let's stay indoors if we can. As nurses become aware of the climate-related effects in their regions, they can better help patients. One particular story bears this out. I was with my sister in northern Minnesota in July. There, the usual tick season is April and May, the time that in the tick life cycle when they need to latch on and ingest human blood. However, with climate change, some tick species can now squeeze in 2 life cycles per season instead of just 1. So July would be considered late in the season, but not for a second hatch. My sister spiked a fever, began feeling very nauseated and fatigued. We took her to an emergency department, and the nurse asked, "Have you been bitten by a tick?" No, she hadn't seen one. And they left it at that. My sister was told she had the flu and was sent home. She got worse. We went to a second emergency department, and they asked, "Have you been bitten by a tick?" No. Then the important question, backed by climate-related knowledge: have you been in an area where you could have been bitten by a tick? Yes, we were in the woods. They ran an immunoassay and discovered my sister had anaplasmosis, a bacterium related to the one that causes Lyme disease, which is also passed along by a tick. She started a course of antibiotics and felt better the next day. Some nurses are in educator roles, so their patients are actually their students. It is important to educate today's nursing students on the connections between climate and health, as they are likely going to impact their careers a great deal going forward. One good, accessible resource is Alliance of Nurses for Healthy Environment, ANNE, open access textbook. It's called Environmental Health in Nursing. Leading environmental health nursing experts join together to share their environmental health knowledge, expertise, and experiences. A new updated edition has recently been completed, but is not yet online. I recently worked on a project with a nurse educator in Ohio who is responsible for the school's community health nursing course. She was delighted to find out about this resource, which she is using now to create the climate change and health connection for her students. Our practice. Not only do health professionals need to know about the health impacts of climate change in general, but they need to be aware of how the healthcare sector is contributing to and impacted by greenhouse gas emissions. The healthcare industry contributes almost 10% of US greenhouse gas emissions. Typical areas of largest impact are highlighted in the gray clouds in this slide from Healthcare Without Harm. Hospitals are the second most energy-intensive facilities in the country and use 2.5 times more energy per square foot than any other commercial building. Hospitals are ranked as the third most water-intensive public building, using an average of about 570 gallons per staffed bed per day. Water is also a major contributor to greenhouse gas emissions because of the energy needed to distribute it, treat it, and heat it. Hospitals serve a lot of food to their staff, patients, and visitors. An estimated 14.5% of global greenhouse gas emissions come from the livestock sector, and food waste contributes to methane emissions in our landfills. US hospitals generate 29 pounds of waste per patient day in the hospital, and the manufacturing process and the transportation of these products also creates 32 pounds of waste for every pound of product manufactured. There are many ways healthcare professionals can reduce their impact on climate at work. Ideas for climate action around hospitals are highlighted in the green clouds. Join or start a green team for large-scale planning efforts. Nurses themselves have created green teams or sustainability group leader positions in some hospitals and systems.
Listen to this.
Nurses make up the largest healthcare employee group. They are the ones that can best support cost and energy saving measures, and they're probably the best ones to convince each other to do so. Nurse-led initiatives have included reducing supplies brought into patients' rooms, recycling programs, institution composting programs, decreasing water use for patients, going paperless, choosing reusable supplies, carefully assessing and reducing linen use, reducing operating room energy use during the off hours, installing light sensors, reprocessing devices, recycling blue sterile wrap, choosing local sustainable foods and reducing food waste in the cafeteria, procuring local foods, reducing portion size of meat served, and increasing the vegetable-based meal options, replacing beef with other proteins. The nurse, Sarah Walford, was an emergency department nurse who became very concerned over tremendous waste she saw, most of it plastic. She began conducting informal studies and convinced her hospital that they could save a lot of money by hiring her to help them become more sustainable. She helped implement energy and material saving practices, which are included in her award-winning June American Journal of Nursing article, Reducing Waste in the Clinical Setting. That is on our bibliography. I heard Sarah speak at an Annie Summit last year, and of course the question came up. What's better? Plastic one-time single patient use items or reusables? And there happened to be a large metal bedpan with a hopper flashing on the screen. Best answer seems to be, well, reusables if you live in an area where water is plentiful, one-time use items if your facility is in an area where water is in short supply. Practice Green Health, it's another site that's on the resource list at the end of this session, is a healthcare membership organization, and it helps facilities become more sustainable, with now 1 in 3 hospitals belonging. Their website contains many healthcare-related ideas, inspirational stories, and support. Several hospital systems in the United States now have committed to 100% renewable energy. Personal habits. From the moment we wake up in the morning to the moment we go back to sleep, there are hundreds of personal choices nurses and all of us can make to be part of the climate solution. From recycling and composting to reducing waste, consuming wisely, and other behavior shifts, everyone can make a tremendous difference. I will focus more on personal habits in the nurses drawdown section coming up. But our partnerships, realizing that group efforts create greater impact than voices of a few, the Nursing Collaborative on Climate Change and Health was formed to build collective support and action for climate solutions. Goals of the Nursing Collaborative on Climate Change and Health, and the members are all their logos are up here right here. They want to elevate climate change as a visible health priority, create climate literate community. They will act as a resource in promoting the education and ability of nurses to deliver effective, evidence-based climate and health communication by providing guides and guidance and incorporating climate in our gatherings and resources. Engage all stakeholders. We will connect climate and human health to engage communities, patients, colleagues, and other health professionals, policymakers, and the public. Numerous other professional organizations, such as the International Council of Nurses, the American Nurses Association, the American Academy of Nursing, and the National Student Nurses Association, have issued policy statements or resolutions calling on members to help decrease healthcare's carbon footprint and advocate for government policies that reduce greenhouse gas emissions and to educate their patients and communities about climate change and health. One recent partnership is between Alliance of Nurses for Healthy Environments, or ANNE, and Project Drawdown, the world's leading resource to help the world reach drawdown, which is the point in the future when levels of greenhouse gases in the atmosphere stop climbing and start to steadily decline. Project Drawdown conducts an ongoing review and analysis of all climate solutions, the practices and technologies that can stem and begin to reduce excessive greenhouse gases in our atmosphere. Their work shows that the world can reach drawdown by mid-century if we make the best use of all existing climate solutions. Each solution reduces greenhouse gases by avoiding emissions or by sequestering the carbon dioxide that's already in the atmosphere. And they've divided solutions into these 9 different sectors. Well, the nurses drawdown are inviting nurses to take action in 5 key areas because they are nursey or particularly health related: food, mobility, gender equity, energy, and nature. Actions are also varied, so nurses can choose to jump in wherever they are most enthusiastic and comfortable. As nurses become involved, they are encouraged to post videos on the Nurses Drawdown website. Food. If 50 to 75% of the world's population restricts their diet to a healthy calorie count and reduces meat consumption overall, we estimate at least 43 to 68 gigatons of emissions could be avoided just from dietary change. If you consider unnecessary deforestation, because it wouldn't be needed for raising animals then, an additional 21 to 23 gigatons of emissions could be avoided. So eating a healthy plant-rich diet is one of the most impactful solutions at a total of 64 to 91 gigatons saved. Plant-rich diets also tend to be healthier, leading to lower rates of chronic disease and saving an estimated $1 trillion in annual healthcare costs and lost productivity. So reducing food waste by not reducing food waste by not letting food go bad, eating everything you buy, and then composting the organic inedible parts, that also reduces methane emissions from landfills. Mobility. On the average, cars emit about 20 pounds of carbon dioxide per gallon, or about 0.8 pounds per mile. You can calculate how much carbon emission you can avoid by walking or biking, depending on how far you have to go. Other ways to become involved with mobility projects are to work towards building a better and safer bike infrastructure. Last thing we need are more bike and pedestrian crashes. And we can help create more walkable cities and support mass transit. We can reduce energy use and promote energy efficiency both at work and at home. Explore possibilities of adding wind and solar. Advocate for cleaner energy sources and divestment from fossil fuels, and purchase carbon offsets when you must fly or drive. As we consider the future of climate solutions, it matters how many people will be eating, moving, plugging in, building, buying, using, emitting, wasting, and all the rest. Population size interacts with the primary drivers of emissions, production and consumption, largely fossil fueled. As more women become educated, they are more likely to have the number of children they wish, and usually that number is smaller. Nurses can support efforts to educate girls and women, and any support of educating girls and women is a climate change solution. Education can be instrumental in family planning. Involving men in family planning is also important. And then nature-based. Plant trees in your yard or neighborhood. Limit the use of paper products and recycle paper at home and at work. Educate on the connection between healthy forests and human health. Spend time in nature for our own health. Researchers have found so many positive health benefits from being around trees. We take care of forests, and the forests will take care of us. The sixth and last P is for politics. Individual efforts to reduce emissions are good. It all helps. But solid political efforts and spending is what is needed to bring about the huge changes necessary. The Green New Deal was written in the same spirit as the original New Deal to pull us out of the Depression. The idea is that we can do it if everyone works together. These goals are a huge oversimplification, The plan further outlines needs for increased funding for developing new technologies, sustainable energy, reducing carbon emissions, carbon taxing, etc. It was encouraging to see that, I believe in July, the US House of Representatives have now taken some of the Green New Deal ideas and assigned them to various committees for development and funding. The picture I included here shows an actual successful climate-related project that happened as a result of many people working together. Maytag washers were originally manufactured in Newton, Iowa. The company left for overseas, throwing many people out of a job. Fortunately, someone was able to secure government grant money and started a wind factory, which then became another source of good jobs for people in the town. Iowa is now the second in the state in the nation for the production of renewable wind energy. The last two new Green Deal goals, clean air, water, safe food, justice, and equity, are all consistent with Florence Nightingale's original ideas about nursing. The biggest action we can take as individuals politically to combat the climate crisis by far is voting, specifically for climate champions at all levels of the government. This chart is from an Eco-America survey with a huge representative sample in early 2019. Americans want climate solutions. This graph shows a political breakdown of those favoring solutions such as a carbon tax or tax credits for expanding clean energy. I would encourage, like the Nurses Drawdown Program, for nurses to do what they can, to jump in at any point where they feel they can be successful. I think we certainly can educate and care for the public, work to reverse the effects of climate change, and who knows, make a better, healthier world. Here are several online resources referenced in this session and a bibliography. And I thank you very much.
Those were two great presentations. I want to thank Dr. Lockwood and Lucinda Cave for recording those for us. You can watch those anytime over the course of the symposium there in the video gallery. Now I would like to open the floor for questions. If you have a question, please type them in the chat box, and we have a few here. So the first one for Dr. Lockwood. Ohio has 2 cities listed on the American Lung Association State of the Air Most Polluted Cities list, Cleveland and Cincinnati. How can physicians get involved in these cities to help improve air quality for patients and communities? Oh, you're muted, Dr. Lockwood.
There are a number of ways people can get involved. Here's one of them: vote. There are a lot of local candidates who are up for election now. There are also, in most cities, some kind of climate action plan. Become familiar with it. Support the people in the local governments who are behind those climate action plans, and do what you can yourself. As both of us have said, to do what we can to reduce emissions and support candidates who are looking to the future to make this a place that we're proud to live in and pass on to our children and grandchildren.
Yeah, so getting involved in advocacy and really championing those legislators that are going to make the change happen.
Give a shout out to the American Lung Association. They publish every year lists of a scorecard for major American cities.
Yes, thank you. A follow-up question. So Ohio also has 5 cities in the top 20 of most challenging cities to live with asthma and allergies. How does air particles and climate change exacerbate these conditions?
Well, I think I covered some of that, particularly in summer months when it's hot and there's lots of sun. There's the ozone levels go up, and that triggers attacks of asthma and other respiratory diseases. It's the fourth leading cause of death due to disease in the United States. That's going to change this year because of the coronavirus pandemic. The carbon dioxide itself, there are some people, the climate change deniers say, well, CO2 is a fertilizer, it makes plants grow better. And that's true. And one of the plants that it makes grow better is ragweed, which is a potent source of toxins that trigger seasonal allergies in susceptible individuals. Just a couple of things about controlling ragweed populations, but the basic underlying strategy has to be reducing greenhouse gas emissions, CO2 and methane particularly, and also nitrous oxide, which is a product of fertilizer use in farm country. And there's a lot of farm country in Ohio.
Mm-hmm. Yes, thank you. Just so everyone is aware, in the chat box, I just posted the survey for this evening's session. Nurses, you will need to fill out the survey in order to receive your CNEs, but I encourage everyone to please fill out the survey because it is great feedback for us as the hosts and the speakers as well. This question is for Lucinda. So with support from the American Nurses Association, are nursing schools incorporating climate change mitigation teachings into nursing programs?
I would say support from Annie, especially the Alliance of Nurses for Healthy Environments. I was at an Annie Summit just last May, or a year ago May, and the nurses who were from all generations, even recent grads as well as nurses who were experienced, none of us felt that we had climate change as a topic introduced in any of our nursing courses. A few students said that, yeah, it's been mentioned, but maybe one lecture in their community health courses. I think, though, now with the efforts of Annie, there are, and with that environmental textbook, that online, fully accessible environmental textbook, I think more community health nurses, instructors are injecting some of that into the curriculum and feel the importance. I've heard one faculty member say, my students can identify that asthma rates are going up. They can identify that there is pollution or wildfires. They can't make the connection yet. And that's one of the focuses of incorporating climate change into nursing curriculum.
Yeah, so a follow-up question from me. I know a few of the physicians I've talked to who are a part of Ohio Clinicians for Climate Action find it really difficult to kind of bring up those conversations with patients, making that link. So Dr. Lockwood, feel free to jump in as well. How can you bridge that gap, especially to someone who may not understand the science of climate change?
That's really tough. The demand for medical services going up, and the time allotted to see each patient in medical care situations is going down. So we're continually being asked to do more with less. So I think it's very difficult to squeeze in any kind of an in-depth discussion about climate change into an ordinary patient encounter. Physicians for Social Responsibility produces literature fact sheets that are designed to be put in offices for patients to pick up while they're waiting for their doctor, hopefully not too long. Uh, and no, and just to get to the curricular aspects of things, I'm sort of far removed now from medical education, but in the past, I was an avid follower of the public health segment in medical schools, and I can't help but think that climate change is becoming an important aspect of public health education because when we talk about climate change and the health impacts, it goes far beyond the ozone and the particulate matter. We have heat, we have floods, we have storms, we have droughts, floods. Almost every aspect of climate change has a health impact that's associated with it.
Lucinda, anything to add?
I think we've kind of covered the need for the education. I guess maybe one point. The students now will be affected by climate change in their own lives more than more experienced clinicians have been affected. And then certainly the patients that they will care for in the future will be affected. So it's even more important than it was, say, when, many years ago when experienced nurses went to school.
Thank you. The final question I have in the chat box, so if anybody else has any questions, please pop them in there now. It's for Lucinda. If my hospital system doesn't have a sustainability department, what is the best way to approach leadership about becoming more climate friendly?
I would say a way that saves them money. That's what they will look at first. And the nurses that I have spoken with and who have written and presented on this topic have all said that it starts with a good energy audit, doing an energy audit and then a trial energy savings mechanism, whether that be closing off rooms during non-use hours, ways and then show the hospital administrators that you have saved them money. That is usually the first hook. Then to go with ways that affect the departments that you are most familiar with. The nurse that I spoke about in my talk was an emergency room nurse, and she saw lots of plastic waste that she just couldn't fathom. Why are we wasting all of this? There's no need for that. And figured out ways that her particular emergency room department could reduce that waste. And again, she brought that into a cost, into a cost picture. And she could show that by a few simple waste reducing measures, she's saving that emergency room a lot of money in additional supplies. So that's the biggest hook.
Yeah, if I could just jump in there, Lucinda's absolutely right. Hospital administrators are just as overworked as doctors and nurses, and one of their major jobs is to generate more income with fewer people and less expenditures of dollars. So looking at the budgets is really important. Now, more than 30 years ago, I was involved in campaigns that later evolved into healthcare without harm. And one of the things that we looked at back then was, and it's still valid to look at today, is the waste stream that comes from hospitals. Hospitals just generate huge, huge amounts of medical waste, perhaps even more now as personal protective equipment is required for known or suspected individuals with the SARS-CoV-2 virus infection, COVID-19.
Yeah, I just from personal experience, I also worked at a healthcare system, and every everything needed a dollar amount attached to it before administrators would, get on the train, the sustainability train, as we called it. So if you can really justify cost savings or cost avoidance in sustainability efforts, that's a great step.
This is Dr. Gordon. I just wanted to chime in here on these last few comments. Thank you, Dr. Lockwood and Lucinda, for your excellent presentations and this great discussion. I wholeheartedly agree that cost is the main way to reach leadership. In addition, another approach in addition to cost could be tying it to key performance indicators, community benefit and things like that, and reducing visits, reducing readmissions and whatnot with appropriate care related to personal environmental susceptibilities. In terms of the previous question about education, this is essential. At the Cleveland Clinic, we are working with our Cleveland Clinic Learner College of Medicine leadership and students as well in creating integrated climate health curriculum. And we're hoping to publish our assessment on that soon. And there's also many wonderful medical students across the country, including the group Medical Students for a Sustainable Future, who are really leading the way in terms of getting climate and health curriculum integrated into their medical school curriculum. Furthermore, there was just a paper published a couple of weeks ago from a national, multiple healthcare systems across the country that they were reporting on climate and health education in graduate medical education for residents and fellows. So this is, I think I would say it's similar to what Lucinda was saying. It's sort of going to be a cultural shift. So the current trainees and students in nursing and medicine at this time are hopefully going to be more connected to this issue and naturally integrate it as a cultural shift into their practice.
Another way that folks can get involved with this is to participate in any long-range planning activities that your healthcare system might be involved in. Again, that relates to cost, and energy prices are not likely to be going down. But the way healthcare facilities are being designed is a huge improvement now. I've gotten way too much healthcare at the Cleveland Clinic, for which I'm extremely grateful. But when you walk into the new Cleveland Clinic Hospital in Avon, the first thing you see is a gigantic staircase that takes you up to the second floor. You don't see a bank of elevators. You walk into a bright, airy space that has lots of natural light and a staircase that invites you to walk up to the second floor office instead of, jamming yourself into an elevator, which is probably not something you want to be doing these days anyway.
That's true. Yes, at the Cleveland Clinic, our sustainability group is within our Art and Design Institute. So we have architecture leadership with Chris Connell leading the group as a whole, and very much involved in the actual buildings and planning of the spaces. So thank you for noticing.
That's one way that.
Yeah, I had just read an article about making climate education mandatory in all levels of education, from elementary through high school. So thankfully, the nursing and medical students who will be arriving in our institutions should have a solid background of climate knowledge and can more easily build the relationships between health and climate.
Yes, hopefully
Yeah.
part of that cultural shift.
Young people are really carrying the torch these days. I live in Overland, Ohio, and before the pandemic put an end to mass gatherings, we had huge rallies sponsored by the Sunrise Movement.
Mhm.
So it's probably the medical students who are going to be teaching the faculty,
That's okay.
and nursing students who will be teaching their faculty what we should be what we should know all along.
Great. I love this conversation. This is great. If there are no more questions, I just want to remind people to fill out the survey if you can. And our next live session is going to be taking place tomorrow afternoon on the impacts of climate change on mental health and hospital resiliency, surgery in the labs. We will have our live speaker, Dr. Gordon, who joined us this evening as well, answering questions tomorrow afternoon. I want to thank Lucinda and Dr. Lockwood. Thank you very much for participating in this symposium and all the work that you've both done on climate and climate mitigation.
Vote.
Yes, vote, yes.
Yes, thank you.
Thank you.
Good night, everyone. Stay safe.
Good night.
night.
Thank you all.